I think we're good.
Hey everyone, welcome back to our live panel discussions with our experts from Empower People and People Against Rape. So for those of you just joining us, I'm Brittany Green from People Against Rape. We have with us today Tanel Jones, licensed marriage and family therapist, licensed addiction counselor, and Empower Health educator. We also have Bradley Burris, the prevention and education coordinator at People Against Rape. And we have April Borkman, Empower Director of Operations.
Hello.
Thank you all for being here today. So as you may have noticed, things are a little bit different today. Due to the current discussions happening all over the world, we decided to take the time to discuss racial disparities in reproductive health. Examining the history of race in Charleston, we can't ignore the fact that Charleston is one of the fastest gentrifying cities in the South, tearing down urban neighborhoods and displacing people of color while building up fancy new luxury apartments and stores that would appeal more to white future residents. I wanted to mention some information that was gathered by the College of Charleston's Race and Social Justice Initiative in 2017. So Black people in Charleston County earn 60% of what their white counterparts make. The egregious violence shown by law enforcement in the Tri-County area is largely unaddressed. And there is a significant gap between access to education for predominantly white schools and predominantly Black schools. And so since our focus is on health education, I wanted to bring up a couple of other statistics. When we discuss health, according to blackaids.org, 15,889 Black people were diagnosed with HIV/AIDS in 2018, and 72% of all women diagnosed are Black women. Also, according to a report by the CDC examining pregnancy-related deaths from 2011 to 2017, data showed that Black women were 3.3 times more likely than white women to suffer the largely preventable death relating to pregnancy. So, hearing these numbers may be a little shocking to some, but these disparities are why we decided to shift the conversation today. So this week will be a little bit different, and all of our questions will be open to the group to answer. As always, if any of our viewers have questions or comments, please place them in the comment section as we go along. So we'll go ahead and get started with this first question. We all do work that's very interconnected, but disparities in the Black community of Charleston may manifest in different ways. So for the question, I wanted to ask, what has led you to do this work, and in what ways are you able to be an agent of change for your field? Who feels most comfortable starting that?
I can go ahead and go first.
Awesome.
Thank you, Brittany. So I think the reason that I got involved in sexual violence is because, whenever I was a part of those conversations, there was such an unwillingness to talk about its impacts and, just the mass effect it has on our population as a whole. You can't ignore the statistics of how many people are affected by, this epidemic. I mean, just the unwillingness to just address it. So for me, that was really important that I joined that conversation, that I get involved. And how I become an agent for change is a hard question to answer, but I think just being willing to have that uncomfortable conversation in order to further amplifying voices and just being able to break the myths down and really get at how we prevent sexual violence, I'm willing to do that. So I guess that's my agent for change.
Yeah, and I think it's very important that we address the issues and have these conversations, because for so long they weren't had. And so if you don't address and identify a problem, then how do you go about creating a solution? Yeah. Thanks, Bradley.
Well, I can answer. I tell this story all the time. If you've ever met me, I've known since I was 5 what I wanted to do, and that was help people recognize their value and their worth. And so being a part of Empower, when I was asked to join this team to do this work, it was a no-brainer for me, because I love being around young people and mentoring them and showing them a different side of maybe what they don't get to see with media, or maybe sometimes in their communities, or what have you. I think even through television, my way of being an agent of change is to express that not only is it about your physical wellness, your mental health wellness, your spiritual wellness, your social wellness, it's just being authentic to that. So when they see me, I hope that they recognize that I adhere to the things that I'm trying to guide them in. So I think the best way to change, to kind of be an agent of change, is to really be part of that process and to do things. Because I do believe that young people can tell somebody who's phony and somebody who's not. And so everything that I try to put out in the universe about making healthy decisions, I do myself. And so that's how I be an agent of change. And
Awesome.
speaking for them when people don't have a voice, I want to be that voice.
Absolutely. So being an advocate and also being a model of what it's like to have that holistic approach to your life and your health. Absolutely.
So I guess I'm next.
Yeah.
I'm the last one. For me, it really, the reason I'm drawn to this work has always been that I really believe in education. And it really comes down to education for me, and I think that giving youth and young people comprehensive, medically accurate sex education is a right. And it's particularly difficult here where we live in the South. We're in the Bible Belt. There's a lot of religiosity and a lot of evangelism. And because of that, there's a lot of misconceptions about what is comprehensive sex ed and what it isn't. And I know from my experience growing up here about, and not getting very good education myself, that it's an important thing. And I think if you can empower youth and kids with that information, you can prevent a lot of things. And so that's kind of the angle that I come at it with.
Mm-hmm. Absolutely. I agree. I think education is the cornerstone of, when we're talking about sexual health and information that's accurate when it comes to sex. And teens need that information. Everybody needs that information to make healthy decisions for themselves. So I will say for myself, doing this work, I just remember as a kid, I was always the one that was kept questioning the status quo and always, trying to stick up for people, even if I didn't really know what I was talking about. That was something that always seemed genuine and authentic for myself. And this work is, working with people against rape, and we're working with, different communities that experience, disparities or oppression. It's so important for people to see themselves in the people that are supposed to be helping them. And so that has been a huge driving force with me. And in being an agent of change, for me, it's also education. It's also having those conversations. It's also looking at things from a holistic approach. So pretty much everything that you guys said, because that's the only way that we can kind of move forward with what we're doing. So does anybody have any other comments they'd like to add? Yeah. Okay. So we'll move on to the next question. What have been some barriers within your organization that make it difficult for Black people in the Charleston area to access any services? Tanel, would you like to go first?
Okay, repeat the first part of the question again, please.
What have been some barriers within your organization that make it difficult for Black people in the Charleston area to access services?
I would say in my short term of working with Empower, I think the barriers could be the school systems, not allowing access to the information. It seems like you got to go through sometimes a bunch of hoops just to get the school to let you in, mm-hmm. and then coordinating it and really being participating in making sure the students get to the place that they need to be to get the information. I think obviously the sex is a hard topic, so just in general, I think just in general the topic itself can be very difficult to reach out to people about. So maybe just even that is a barrier, and not necessarily maybe not having a lot of health educators. I don't know. Maybe there are more that's needed. And so sometimes if it's just April and I and there's a lot to do, mm-hmm. that could be a barrier as well.
Absolutely.
I
Have it
agree. Tanel, that's exactly what I was going to say too. Well, there's a lot of barriers, but that in particular, because when it comes to, if we're talking about reproductive health education or reproductive health, we can really very quickly and easily sort of even the playing field by providing education across the board for all youth. And we do see, and we can really reduce the rates of unplanned pregnancy and STIs and HIV and things like that across the board. But we also know that Black youth are particularly and disproportionately affected by those things. And so if we're able to get the education into the school where the majority of Black youth are attending public school, then we can really start to even out the disparity just by educating people. That's not the end all, but it's a start. And for those watching who may not be aware, we do have the Comprehensive Health Education Act in South Carolina, which sounds really, really great on the surface. Like we have this law that requires schools to teach comprehensive sex education. It sounds really great. When you really boil it down, though, there aren't any teeth in this law. Schools are not really held accountable for it. Also, the term comprehensive health education in this particular use of it is very loose term. And so actually what schools can do is teach abstinence only education and still be able to check off that box that they taught sex education. And we know from research that abstinence only education is not as effective as comprehensive health ed, which, comprehensive health ed provides information about birth control methods and, safer sex practices and really gets down into like the nitty gritty of how to protect yourself. Abstinence only just kind of glosses over and says, wait until you're married, which is not meeting teens where they need to be met.
Right.
And so I think we can, that's a barrier. The fact that we can't get into the schools and be able to provide this information at the level that we should be able to provide it. Transportation, as Tanel said, is a barrier for a lot of teens being able to get to programs outside of the school, like Empower. We're limited on how much we can serve teens because not all teens in Charleston County have access to transportation to get to our programs. And also another barrier is that federal funding is hugely important for our program. And I'm sure that, that affects People Against Rape as well. And federal funding is really, it's key. We have to have it in order to perpetuate all of the gains and keep the gains going that we've already made. And that money is dwindling. And the current administration is slowly, kind of like pulling money away from that, and we have to have that money in order to survive. So then we end up competing for very limited dollars with other organizations, and then what happens is it really comes down to, well, how many people are you serving, and it really becomes more about numbers rather than quality care and services.
So definitely centering those people in the work and not just trying to prove that we're diverse and reaching a certain certain type of person.
Yeah,
absolutely.
Well, I guess I'll go next. I do just want to start by saying that Brittany and I had a large conversation about all of the questions that we're going to answer today. And we just pulled out a few main points of what we discussed. So I just wanted to say that because not all of these thoughts are my own. And it was a really important conversation. So one of the key things that we came from with this barriers topic is location. We are located downtown Charleston. It is a space that is not accessible for everyone. And we've recognized that. And it's also in an area, like you mentioned earlier, where downtown Charleston continues to gentrify rapidly. So, we're a part of that space. It also historically is a white space. PAR has largely been a group full of white people. And when you look at it historically, although it is changing, when you are accessing that service, you see that it is reflected of white people. So it's not necessarily always seemed like a place for everyone. And then we also discussed the layers of racial context within sexual violence. Trusting the hospital, the advocate. Do they understand these many layers that come with being a minority that has also been assaulted? And just knowing that the justice system cannot always be trusted.
Mm-hmm. Absolutely. Thanks, Bradley.
Yeah.
I think it's important for us to acknowledge these barriers so that we can do what we need to do to create a more holistic and safe space for everybody. So in terms of reproductive health and sex education, in what ways do these racial biases impact the ability of a person to make, healthy and smart decisions for themselves?
I would say, again, so maybe finding a healthcare provider. So if there's nobody in the community that looks like me, that I feel like I can go talk to without maybe even judgment of my life, my experiences. I'm speaking kind of maybe like as a youth, like a young person might be thinking, then I'll just listen to my friends. It's probably easier just to talk to my friends and to go talk to somebody who doesn't know me, who doesn't know my community, who's probably going to be judgmental, who's probably only giving me something just because I have this wonderful insurance, maybe called Medicaid or something. So not necessarily asking me what would be best for me. So that I think that's kind of something that's pretty significant to consider. So, and I'll jump in at other points as well. I just want to highlight that.
Mm-hmm. April or Bradley?
So, I mean, just coming from an education angle, I'll try to answer the question the best I can. But if we're not, and we're talking about how to get, people and youth, and in this particular case, Black youth, to really advocate for themselves, right? So, if we're not able to educate them on their bodies, then they're not going to be able to advocate for themselves when they go to the doctor or when they talk to their parents or a trusted adult about reproductive health issues. So again, it really goes back to education. And I think we do a really good job within our program of teaching kids about their bodies and about how they work and about how to prevent risk or negate risk. And we do a really good job of educating them on how to talk to partners. What we don't do, and I was really thought about this question whenever I was preparing, is what we don't do, and I think one thing that we should think about doing and changing is we don't talk to them enough about how to advocate for themselves with adults in their lives, because they really are, a lot of them are dependent on the adults in their lives to get, the reproductive services that they need. And so I think we could do a better job of talking to them about how to advocate for themselves and how to communicate with their parents, and also what questions you should ask an adolescent, a pediatrician about reproductive health. And so I think it's very, very hard for teens to advocate for themselves without that. They need that mentorship and that practice and that education.
Yeah.
I hope that answered the question, but.
It did. I think it's important that they have the language. I think language is very, very important. And we've discussed it in some of our previous panels, just how if you have the appropriate language, then you have the confidence to stand up for yourself and ask for what you need.
But I also don't want to be remiss in not acknowledging the fact that even if you look at research and you look at the mortality rates for Black women having babies, it has nothing to do with their education, their socioeconomic status. That's just a racist system that needs to be changed. And so sometimes I think, yes, we can educate, but we also need to acknowledge that there's a system that exists, and no matter how well educated a person is, that system may be against them and make it hard. And that's, why I really wanted to have this conversation today, because that's the ultimate thing. Like sometimes I think, we've been talking about, race issues, but there are systems that is very hard to change unless the whole system changes, and pointing that out. So I kind of wanted to say that as well. Like that is a huge area, is that the healthcare system in general.
Yes.
Right. I'm glad you said that, Snell, because that was another another thing too is that we know from research that Black women are less likely to be believed in the healthcare setting than white women. And so that's another reason why I think it's important to teach our teens that because the teens that Empower serve are primarily Black teens. And so I think it's important to teach, especially our Black females who are in our program, how to advocate for themselves better in a healthcare setting, because we already know that they're going to walk in there and be less likely to be believed. And they're not going to get the same equitable care that a white kid or a white woman would get. So I think that kind of speaks to some of the things that are already working against them that we need to keep in mind when we're doing this work.
Yeah, I think it's important to absolutely address the language and the education, but if we don't address the actual system that's kind of leading us to have these conversations, then we can't really move forward.
True. Yeah.
Some of the points that Brittany and I came up with, and it's more in the context of when someone is seeking reproductive health after a sexual assault has occurred. So just the emotional labor of having to explain those layers. If you have a Black trans woman, those are 3 identities that are intersecting that person's going to have to put emotional labor into just to explain to whoever's helping them. The whiteness of advocates, going in and knowing that there's someone there to help you, but does that person will never be able to fully understand what you're experiencing. And being able to trust someone to help you through such a vulnerable situation is a huge thing. I don't think we express that importance enough, that it is so much trust. And that's not easy. And then, of course, the last one is just a mistrust of medicine. When Brittany and I were kind of talking about this hospital atmosphere, as soon as you walk in, it's very overwhelming. There's a lot of sounds, there's a lot of smells. Is it accessible to you? Are you overwhelmed by the lighting? Is the amount of people in the waiting room, can you handle that? There's also, typically some type of authority figure that is wearing almost like police uniform. And that can be very triggering, upsetting, overwhelming. For anybody that's just trying to seek services after something that just happened, that is absolutely traumatic.
Mm-hmm. Yeah. And I also think it's important to focus on that distrust of the medical system because it is correctly placed. For a lot of medical research that has paved the way for all people, it all was based on, this research on slaves that they could not consent. There was no concern for their well-being, their feelings, their lives. And so Black people have a reasonable distrust for the medical system. And if you don't feel that you can trust the people that are supposed to be saving your lives, that is also a contributing factor as to, why we have these huge numbers and, high blood pressure and these mortality rates and, all these things that are preventable and seem to be, appropriately prevented in other communities, but with Black people, it's just not. So I think it's definitely important that we acknowledge that. So, and speaking on, some of the things, some of the conversations we need to have and some of the things that, cause these barriers and make it difficult for a Black person to receive the services and the care that they deserve, as a community or as an organization, what actions can we each take in our organization to make our services more accessible and more, I guess I'll say the word appealing, in reaching these other communities?
So I've kind of, in the work that I've done, I've been willing to go anywhere and everywhere. And so being able to think outside the box, like even if, we can't do it in schools, can we do it in community centers? Because I think a lot of neighborhoods have community centers. So they're thinking about that before, obviously now we have COVID-19. And so even this platform that we're using virtually to reach people and figuring out different ways to do that. And something that I'm constantly kind of considering, how do you reach the people so the information is going to be available to them, and just recognize that there should be no borders around that, because there's more than one way to reach people. And sometimes I think we believe, or sometimes providers believe there's only one way to do a certain thing, or all Black people are the same, and so we should just box it up that way. Like, no, that's not true. To really just addressing the differences in the individualism of everybody, but also being equitable in that delivery.
Absolutely.
I mean, I think Tanel covered that. I mean, from an Empower perspective, and we're all about reducing barriers.
So at PAR, we are experiencing a lot of organizational changes. One thing that our interim executive director has just been amazing about is that we're no longer just sitting in our space, in that space downtown. We're going out into the community. We're trying to not just exist in the same spaces that historically we've always been in. So, that would mean, Brittany or I to a community in a county that maybe we haven't spent as much time focusing on in the past, and saying, what can I do for you? What do you need? Having those tough conversations. Also listening to other organizations. We know that there's people doing the work, and learning from each other and watching how we can improve, I think, is something that a lot of us don't utilize enough. I can say for myself, this is some of the most collaboration I've ever been able to do with other organizations, and I've learned a lot. And I think, past working remotely, it needs to continue. Slowing down and gaining trust. I think that so many of us, we're always pushed to just keep going, meet a goal, whether it's a small one, and just keep succeeding. But when you're entering these communities of all different types, we need their trust. They're not going to want to immediately listen to my mission. It's about sitting down and learning about, what is their goal? What is their mission? What have they been through? What is it like trying to function in Charleston, in Dorchester, in Berkeley County? So just taking that time, and then, of course, educating ourselves. We can always learn more. We can always listen more. And I think that we don't allow ourselves to listen to people who have been doing the work, who are experts in their own experience, who recommend, books, movies, podcasts for us to listen to. And we always say, we'll get to it later. There's always time to sit down and listen to someone else trying to educate you.
Mm-hmm. Absolutely. Do you have anything, April, that you'd like to add to that?
I don't. I mean, I think you made a very good point there, Bradley.
You're on mute.
We can't hear you.
Yes, thank you. We're having technical difficulties today, for those of you who are watching. Just FYI, you guys, you panelists are just learning about the technical difficulty. But so far, I think everybody's been able to hear everything that we've had to say. It just looks a little funny on the live side of it. But anyway, Bradley, I think you made a very good point. We do have a couple of audience questions. If you guys are ready for that, or do you want to hold on? You want to go for those, Brittany?
Yeah, let's go for it.
So let's see. And I think this is asking the question to empower, but does the curriculum that we use include, equality of all? And I think, so to answer that question, the curriculum that we actually use, the evidence-based curricula, the reproductive health curricula that we use, it's a very generalized, non-specific curriculum. So you can actually take that and adapt it and pull pieces in to make it more specific to the audience that you are trying to reach. So it gives you room to build upon it. And we do try to do that. Tanel does that. We also have another curriculum. That's just one of them. The other one that we have is CLA, which is specifically for African-American female teens. And I don't know if Tanel, if you want to speak a little bit on that program, just kind of describe that for people who might be watching.
Yes, CLA is a program that we have that incorporates not only information about sexual reproductive health, but also gender pride, ethnicity pride, healthy relationships, communication skills, And so it involves a lot of different things that I think our young ladies would benefit from. Obviously, the other side of that is I also think that there should be something for young males, which they're kind of always left out. So they get that piece maybe in Making a Difference program that we have, or Making Proud Choices. But I really do enjoy CELA because it allows young Black teens to connect, to celebrate themselves in a way that sometimes when you talk about teen pregnancy, or the shame that comes of oh my gosh, you had sex before you were 16, maybe the shame that people get, this doesn't like, it's not shame and kind of putting shame out there. So I really enjoy that as well. And I think Making Proud Choices is the same, because as I'm doing and I'm asking, I'm able to get answers from the people who are participating, and they get to use their own language to describe something. And I like that piece as well.
Yeah, I think it's fantastic that it's centered on a celebration of self. And I think that definitely is missing so often, especially with young Black women.
Right. I mean, and pardon the pun, but it's very empowering, right? That's kind of like the purpose of it, is to empower these young women to go and really advocate for themselves.
Do we have a...
stands for those, CELA stands for Sisters Informing, Healing, Living, and Empowering. And so that's the title of it. And I think we will hopefully be having maybe some web, so you can go on the CELA web coming up to get more information and to be involved. So it's really a neat program.
Yeah, we're working on making, we have a web version of it that we created some years ago, and we're working on making that available for free to the public. So we'll be, letting everybody know about that, and so stay tuned to that, I guess. So stay tuned to our social media, because that's probably where we will be posting most of the information.
Awesome. Do we have another question?
I think that pretty much covers that question. Tayshawn Brown says hello, though. So hi, Tayshawn, if you're still watching.
Awesome. So we did have one more question. I think we kind of discussed a little bit when it comes to organizations, as far as, how we can address that. Do we have anything that you guys would like to add as far as how we as a community together can empower individuals to regain autonomy and make healthy choices for themselves?
Yeah, I can go ahead. So going back to just like what grassroots means, going into the community and really refocusing why activism started in the first place. Grounding ourselves in the community, because it gets so large, right? We attend seminars, webinars, the conversation gets watered down, but often it was started by a circle of people saying, I'm over this, we have to do something. And I think a lot of us, at least I know for me, could really use that connection. And that, kind of goes back to my other point, re-energizing our advocacy. We have to take time for ourselves, and it's really hard, but there's always space to just take a minute, take care of yourself, drink the tea, take a bath, do whatever you need to do, because you cannot participate in advocacy long-term. It's not sustainable if you're not taking care of yourself. So in order to do the work, we really have to be centered. And then also just creating solutions and taking action. And that's not necessarily for me in this movement that we're experiencing right now. For me, my role is to listen and to continue to listen and learn from the people that have been doing it for generations, but always being willing to support those who are doing the work however you can. Signing petitions, talking to representatives, whatever it is that your part is, and helping create a movement or advocating, we need to be able to listen and learn.
Yeah, I agree. And I think centering the people. Another thing that Bradley and I talked about before has been that we are always tiptoeing on this line of, is that too radical? Is that too far? But when it comes to people's human just humanity itself, there are no blurred lines with that. It's, taking the hard stance and being clear on what your mission is and what's important, and that's the people. Do you guys, April and Tanel, have anything you'd like to add?
I mean, I don't think I could say it any better.
I think you both said it, said a lot. I don't know if I would add anything. I think as a community, is always going to come back to being honest about the history and how we got here, and then what can be done without sometimes assuming that sometimes the people that are already in the seats making the decisions, that they have the ability to make these decisions. So kind of sometimes looking at that differently. But I think the honesty piece of really, how are we here that you have, these high numbers of Black people impacted by STIs, and how do we get here, other than just kind of saying, oh, it's just their behavior. No.
Yeah.
Really, really being honest, and then doing something, because we have a lot of talks. So now what's the action?
Right.
So really having those organizations say, this is what we're going to do differently, and this is how we're going to do it.
Mm-hmm. Absolutely. And remembering that it's a system, and it's not just individual incidents. It's an entire system that has oppressed people. April, do you have anything to add?
I think you guys covered it. Yeah.
Mm-hmm.
I agree with everything that you guys said on that topic, for sure. Mm-hmm. And so, I mean, I think to just piggyback off what Tanel said, just sitting back and, I know that I'm learning a lot of new things myself at a personal level right now, about everything that's going on, and how, my behavior as a white woman has been complicit in all of this. Even when I, think it's not, it is, or when I'm not trying to be, racist in some way, how my behavior still contributes to the problem. And I think that we all need to do that right now, and we all need to look at how our behavior in our personal lives, but also in our professional lives, is impacting people around us. And that's, not a lot of change is going to happen. Like Tanel said, the people who are in the positions to make the decisions are in the positions to make the decisions right now. And not much is going to change until we can all look at how our behavior impacts other people.
Absolutely. I think that's very, very important, is what work can we do as individuals, as ourselves? Because we are society, we are the community. What kind of impact can we make for ourselves? Absolutely.
And for those community organizations that may say, oh, well, we're going to, reach out to this one Black person, that's going to be our voice. Please recognize that there's diversity in thought and everything when it comes to Black people. So don't just be like, well, we got a Black person on our leadership team. It takes more than that. So do something different.
Yeah. And not this surface pandering type of diversity, but real diversity.
Right.
Absolutely. So that was all the questions that we had. Do you guys have any comments that you would like to make before we close?
No, I just want to say that, this is a good conversation. I'm glad we had it. I think we could probably talk for hours and hours and hours longer about this. And this is just really the teeny tiny tip of the iceberg for people who might be watching, who are kind of learning about this now. There's lots and lots of resources out there. And so reach out and try to find what those resources are in your area.
Mm-hmm. Absolutely. So I would like to thank everybody for watching, for allowing us to have the space to have this conversation, especially with everything going on in this nation. And it's really important that we take these moments to take pause and really address these issues. So we hope that these conversations don't stop. There's still so much work to be done. As Tanel said, we talk about it. Now let's put it into action. So I would also like to say thank you to all the panelists today for this wonderful discussion. So to everyone watching, remember to keep checking back on our social media sites on Facebook, Twitter, and Instagram for more educational videos. And next time, we will be talking about birth control and pregnancy. So if you have any topics or any questions you'd like for us to discuss, email april@borkman@musc.edu, or reach out to us via social media. So we really appreciate you guys taking the time with us. Bye.